The facial profile you wanted always. The harmony of the face, which is very appealing, and the function you need for your life. Yes, we are talking about cosmetic jaw surgery, technically called as orthognathic surgery. Hi, I'm Dr. Suresh, Senior Consultant, Maxillofacial Surgeon, Gnathos Face. Many people have a problem in their facial profile. Either the lower jaw is forwardly placed or the upper jaw is forwardly placed, or reverse of it. The lower jaw is backwardly placed, upper jaw is backwardly placed. So people are unhappy about their appearance. So these surgeries are called as profile correction. Now, think beyond braces. Many people get confused for the jawbone alignment to the teeth alignment, and they seek corrections with only the teeth alignment. Understand this way. Jaw bones will be the foundation for your teeth. If the foundation itself is misaligned, definitely the teeth are misaligned. Without correcting the foundation, that is the jaw bones, if you correct the teeth using aligners or braces, that can lead to a permanent disability or a problem. So before you get corrected your teeth alignment, please consult a maxillofacial surgeon. Check whether your jaw bones are properly aligned so that you can correct your teeth. Why is this profile correction surgery is needed? It is not just cosmetic. It enhances the overall harmony of the face. It also improves the biting and chewing ability of individual. Many times, especially when the lower jaw is set back, people have a habit of snoring. So with this profile correction surgeries, permanently the snoring is cured. That we call it as obstructive sleep apnea surgical procedure. The new you. With the correction of this profile of the face, the appearance of the person is changed, which enhances the look and overall self-confidence. The way people perceive your facial profile is totally changed. It eliminates a gummy smile, which is the long face, or a short chin or a short jaw. It also corrects the snoring. Third most important thing is it also corrects the soft tissue envelope which is covering the facial bones like your nose, cheek, jawline. Someone has got a very forwardly placed upper jaw, the nose seems to be very crooked or tilted. People correct only nose and forget the foundation of the nose, that is your jawbone. If you correct the upper jaw, automatically the nose becomes straight. If you want an enhanced look of the jawline, if you correct the lower jaw, the enhanced look of the lower jaw is definitely achieved. So these surgeries are done for cosmetic, functional, as well as to improve your overall confidence of an individual. If you find this information interesting, please share it with the people who are in need of it. Thank you for watching this video.